Nowadays, there are many options for patients with follicular lymphoma, and there are many on the horizon. I think the most important thing, which really is a simple, very important study, the one I mentioned from Carla Casulo, showing that those who have relapse early, it's really a common sense finding, tend to have a worse outcome. And I think the most important aspect of this is knowing who we need to be gentle with, and that's the folks who don't have an early relapse. And really, we need to minimize toxicity in that 80% of population. The flip side is those who have an early relapse, like this gentleman in the second case, we really need to talk to them about novel agents, non-traditional chemotherapy approaches, and clinical trials. So I mentioned idelalisib, which was approved. There are a number of agents that are in randomized trials. There's some encouraging data using lenalidomide. This is an immunomodulatory drug. Single-arm studies have shown in the frontline setting complete remission rates from the MD Anderson study up to about 90%. A similar patient population or similar setting from the Nordic study showed by investigator assessment only a 36% CR rate. However, these encouraging data with lenalidomide and rituximab have led to a large randomized phase 3 trial, so-called relevance trial, comparing this R-squared regimen to investigator's choice standard chemoimmunotherapy. So that trial is going to take some time to read out, but this really could be a very important finding to show that we can now get rid of traditional chemotherapy if it's positive and use lenalidomide immunomodulatory therapy plus rituximab. There are a variety of other strategies that are coming down the pike. There are other B-cell receptor pathway agents such as SYK inhibitors. There's some data with BTK inhibitors. There are antibody drug conjugates such as polatuzumab vedotin is one. Chimeric antigen receptor T cells are also looking very encouraging, particularly for those that have very refractory disease. There certainly are anecdotal reports of folks that have had disease that has not responded to anything that are achieving long-term, long-lasting remissions. And finally, allotransplant. Allogeneic transplant is something that's still on the list for patients that are younger and fitter and does offer a potentially curative strategy. So in summary, this is actually a very exciting time in terms of novel therapies for follicular lymphoma. Gone are the days of simply giving patients chemotherapy. We have a variety of options targeting various pathways and aspects of both the patient's tumor and the immunological microenvironment. And certainly we hope this will translate into improved long-term outcomes for our patients with follicular lymphoma.